So in this case, does the AI just tell you what to do, or is there still kind of like a human decision aspect to it?
Yeah, it's important to note when I say clinical decision support, that is an FDA term. Uh, so we do not make the decision for any clinician. We do not force function anything. We provide the clinician with the information needed and the why behind it. And that's a key factor of clinical decision support, is that it's not a black box. It's not just going to do something automatically. It tells you the why behind it. So if it says your patient's high risk for falling, it's going to tell you the top reasons why they're at high risk for falling. And yes, recommend something that has been kind of agreed upon with the hospital system. Again, not forcing that. That's, we work with our customers and our health systems to, go with the list of interventions they have available to them. But at the end of the day, it's still the clinician's decision. They still are the licensed practitioner, and we trust their judgment. There's always going to be things that they can see in real time, and so there is no force functioning. It's not something that they can't see behind the curtain. They can absolutely see, the why behind the recommendations that are coming to them.
Right. I think that like one of the biggest things that I would think about when it comes to AI and just how it is starting to insert itself into different aspects of our, everyone's everyday lives is kind of considering like, does that take away from the human aspect of it? Because I think we've all seen versions of Black Mirror or something where some dystopian future where some kind of AI overlord is forcing everyone to do something or act a certain way or changing the way complete things we look at things. So from I imagine from like a medical perspective, since like medical care is like some of the most human possible like relationship that you can possibly have between a patient and a doctor, patient, nurse, et cetera, throughout like our entire like human existence. Like, has there been any pushback from the medical community about adopting more AI tools?
I can't really speak for the medical community at large, but I think there is an understanding and an acceptance that AI is coming. It's here in many ways. I mean, it's in the common zeitgeist of our culture at this point. Um, it's going to impact healthcare if it hasn't already. I share this with my fellow nursing colleagues that I really want nurses at the table, because these things are going to happen, and we need to be involved in the decision making process behind how AI impacts clinical care, or it's going to be decided for us in some way. And so, I think this is definitely an area of healthcare that's not going away. And I'm very hopeful. I'm very much an AI optimist, and I have no formal education in AI. I'm a nurse. I went to nursing school. They don't teach AI. They don't teach computer programming. I found my way into this. That's a topic for maybe another day. But the important thing to know is that I truly believe that clinicians and nurses especially go into this world and into this career field with a purpose. They go to make a difference. They go to be, help their patients and care for people. They don't go to be administrators in the sense that they're not there. I've never found a nurse that likes documenting. We understand why we document, but we don't love it. Uh, so at the so and we go into it to be clinicians. Like, we are licensed professionals who are licensed to assess patients, make care plans, administer high risk medications oftentimes, and really do the bulk of the work that's actually done inside of a hospital setting. And I do believe that AI and machine learning is offers us a chance to really hone in on that and get back to that and start to take away the extra stuff that we as nurses and clinicians spend our time doing that's not value added. It's not bringing value to our patients or to our own workday. Um, Kinemetrics is just one example, and I know it's a small win in that you no longer have to do a extra nursing assessment for falls. But at the same time, the other big win is there's a lot that goes into a nursing assessment, and there's not a lot that comes out of it. Believe it or not, we as nurses spend a lot of time filling in a lot of flow sheet rows, sometimes writing notes, and they're not often even seen by the care team. And this is a way that is bringing value to that. It's taking the information that the expert clinician put in there in the chart and doing something with it and giving them back value. And I think that's just a kind of a first step in the transformation of what AI can do for healthcare and for our healthcare workforce that is increasingly stressed and burnt out, is giving them back the value in what they're doing, showing them that there is value in, documenting a really good assessment because they're going to get something back from it. There's machine learning or AI will be there to help them use that. It's never going to replace them. I think we are so far away from that, Skynet on the bad end and like the helpful robot that does your job for you on the good end. We are ways away from both of those things in the healthcare world. Healthcare generally adopts technology a lot. I was going to say a little, but probably a lot slower than, consumer areas and things like that. Um, but even if we weren't that slow, we'd still be a ways away. And so anytime one of my nurse colleagues asks me if AI is going to replace them, I just kind of chuckle. Not in my lifetime, certainly, I don't believe. But again,